My name is Gabby Hobbs, and I practice at Mass General. I've been here for 3.5 years, and I'm the clinical director of the Leukemia service, and I primarily see patients with myeloproliferative neoplasms. A few days out of the week, I see patients in the clinic. When I first meet a patient with an MPN, oftentimes they've been seen by other practitioners elsewhere, or they've had these diseases for a long time and sometimes don't have an understanding of what they have, or this is new to them and then they're scared. But whatever it takes to just make sure that when my patient leaves the room, they have a really clear understanding of what they have. I really get to know my patients, and I really enjoy that aspect, to really see how they do in the span of several years. In the days that I'm not seeing patients, I'm sitting in my office doing research or meeting with other investigators to think about new research projects. The biggest part of my research is clinical trials. And clinical trials are basically ways in which we can test new drugs for diseases, or we can test old drugs in new ways. I also do translational research, and a big component of that is collecting samples from patients that I see in clinic, and then using those samples in the laboratory to understand basic mechanisms of these diseases, to try to ultimately better treat these diseases. And then the third part of my research would be related to outcomes. And so here at MGH, we see a lot of patients with myelofibrosis or myeloproliferative neoplasms. And since they're rare, belonging to a larger cancer center is really helpful to understand the outcomes of these patients. The JAK2 mutation wasn't discovered until 2005. And so the amount of knowledge that we now have compared to then is significantly greater. And so I really enjoy being able to not only be a part of a community that's making those discoveries, but also to be able to talk to my patients about this, to really give them hope, to have them understand that although they have this disease, we really understand this disease so much better now than we did before, and there's a lot of hope, and there's a lot of treatments that are being developed. The advice that I would give a newly diagnosed MPN patient is to remember these are rare diseases, and so sometimes the information that's out there may not be reliable. So having a good relationship with an MPN doctor and with somebody that's familiar with these diseases and can answer all of your questions, I think, is crucial. It's an honor to have been recognized as an MPN hero. Helping MPN patients is the reason why I come to work every day, and being able to take care of those patients is something that I take great pride in. I try to do the best I can to take care of those patients and to really help them get the treatment that they need.